Hello and Namaste. I'm Dr. Ashish Karn, a hybrid international emergency medicine trainee and an associate member of Royal College of Emergency Medicine. And I'm currently doing my fellowship in quality improvement from World Academy of Medical Leadership. In this video, I'll be talking about my quality improvement project. To begin with, I'd like to introduce you to my thesis topic, which is knowledge, attitude, and practice of hand hygiene among healthcare workers in the emergency department. To begin with, let me tell you the story of Mr. John. John, a 30 years old male, visited the hospital emergency 3 weeks back with a minor fall injury, which required dressing and suturing. Due to lack in infection control measures, especially hand hygiene, he developed a hospital-acquired infection. He is undergoing treatment for the last 2 weeks. His organism has been identified to be a multi-drug resistant. The situation has caused him and his family a lot of emotional stress and financial burden. John's case proves how important this topic of hand hygiene is. Healthcare-associated infections due to poor hand hygiene is a major cause of increasing morbidity, mortality, and healthcare cost among hospitalized patients worldwide. Most nosocomial infections are thought to be transmitted by the hands of healthcare workers. It has long been known that hand hygiene among healthcare workers plays a central role in preventing the transmission of infectious agents. Compliance with hand hygiene recommendation is the most important measure in preventing healthcare-associated infections. Healthcare workers can also become infected during patient care. Nosocomial clustering with transmission to healthcare workers is a prominent feature of COVID-19. Performance of high-risk patient care procedures and inadequate infection control practices contribute to the risk. Despite international guidelines and local protocol in place, compliance among healthcare workers remains low in our emergency department. So, a study to examine factors influencing the risk judgment among healthcare workers in terms of their individual knowledge and healthcare belief is important. World Health Organization has developed evidence-based WHO guideline on hand hygiene in healthcare to support healthcare facilities to improve hand hygiene and thus reduce healthcare-associated infections. It provides a comprehensive review of scientific data on hand hygiene rationale and practice in healthcare. The WHO guideline presents the evidence base for focusing on hand hygiene improvement as part of an integral approach to the reduction of healthcare-associated infections. Implementation is of utmost importance to achieving an impact on patient safety and improvement of healthcare. Participants will be given a participant information sheet and a written informed consent will be taken in this form. Each participant will be allowed to have a voluntary choice for participation. Strict confidentiality will be maintained. Approval and ethical clearance has been taken from the Institutional Review Committee of Chittoor Medical College. Data will be collected using self-structured questionnaire. 3 questionnaires have been developed for knowledge, attitude, and practice separately. Data will be entered and analyzed in SPSS software and represented through bar diagrams, pie charts. I will publish my work using Square guidelines. Now that you know about my research, I'll develop my thesis as a quality improvement project using quality methods to help improve the hand hygiene practice in our department. Here is an Ishikawa fishbowl analysis showing the different factors leading to non-compliance in hand hygiene in our department. Here you can see people, method, material, equipment, environmental factors leading to non-compliance in hand hygiene in our department. I'll also be doing a stakeholder analysis and using experience-based design to involve healthcare workers in my project. I have planned a demonstration where I'll be using glow-warm gel and UV light to show parts of hand commonly missed during hand washing. As you can see in this video, how important hand washing with proper steps and adequate time is. WHO recommends a minimum of 20 seconds for hand washing. I'll also be doing a teaching session to show importance of hand hygiene. A time series data will then be collected and improvement measured accordingly. This is a Gantt chart showing my project's planned schedule and its tasks over the next 3 years. Finally, I'll conclude by saying hand hygiene is one of the key cornerstones of COVID-19 prevention. Now, more than ever, hand hygiene needs to become an integral part of our daily routine as we embrace the new normal, live through this pandemic, and beyond. Namaste from Nepal.